and the deck when we send our follow-up email, but we'll also post those to our website along with other meeting materials so that everybody has access to them. And we'll continue to admit folks here, but Lauren, if you want to hop over to just the meeting logistics. We do, like I said, roll call, name and organization name in the chat. Love to see your faces, not required, but always encouraged. And we, if you can or want to update your Zoom information by clicking on those three little dots, it can be updated for your name and your organization name so that when we get into the working session, and break out into groups, that's there for the rest of your group to see. All right, next slide. So what are we talking about today? Today, we're just going to do a quick recap on where we've come from over the last couple of months. We have a poll for you all. We're going to get started in data collection, some of the things that folks have been asking for a while, around baseline data and some other data elements. It's going to help us with our collaborative work. For those of you who recall our last month's meeting, we broke into groups for a longer period of time, and we started to prioritize different activities. So we're going to do that a little bit more in today's meeting as well. So we're kind of picking up where we left off and continue to move things forward. And then we'll go into next steps. Where do we want to see ourselves for the month of July? All right, next slide, please. So again, instant replay. That San Diego CPI Slack channel is there for you. I encourage you all to leverage it. You don't necessarily need us to post. If you have things that you want to share with your colleagues in the community, please feel free to leverage that and crowdsource that if you all are having an issue, or if you need to pose a question, or if you are soliciting feedback from other members of the CPI. We'll continue to share information through that Slack channel as well. We know that surveys are a lot and that you all are surveyed quite a bit for a number of different things. So we'll try to do some creative things around 1 or 2 questions via Slack as well, to just kind of make it less of an administrative burden all at once. Focused area discussions, those are continuing, and we started in May really dissecting some of our change ideas and prioritizing them, and then focusing on different things that we might be able to do together, either in a small group or in a bigger group, to prioritize and then test out some of those changes. Okay, next slide, please. So this is sort of just a snapshot of how far we've come and where we're headed. So, you know, early on, we talked with you all about some of the logistics around quality improvement. We try to stay out of, to some degree, that lingo, but we got together in January to really kind of talk through what's called an aim, but really our goal, and how do we want to measure that goal. So in many ways, SMART goal, aim statement, but at the end of the day, it's what do we want to try and accomplish together, and how might we measure that? At the end of this, what does success look like? And so we created an aim together along with drivers for ways in which we can get that aim. In addition to that, we put a supporting measurement strategy together. So the drivers are really just those categories, the different things that we want to look at. And then we tease them out in more detail. That's that Google Sheet that we've been talking about. And some of the measurements to solidify some of those things along the way. And we'll talk a little bit more about measurements in the next couple of slides. May and June is where we started and where we'll continue kind of thinking about different things that we could work on. So identifying some of those activities. What do we know? What do we not know? What's the lift? Do we have interested parties that would want to participate in a pilot? What could we test? And we'll continue that into the summer months. And then in the last quarter of the year, we'll look at sort of reflecting on some of the work that we've been able to do, and then think a little bit about sustainability and measuring success and planning for the future. So look back, look forward, that's sort of where we've come, where we're headed. And next slide, please. Now we'll get into a couple of our polling questions for the day. And I think, Danny, if you're on, I'll hand the mic over to you to present these.
Sorry, I'm on, but kids are in the background. So just if you hear kids, that's why they are here. So really quickly for measuring change, we've talked about this before, but we are in the process of coming up with what's called our measurement strategy for the collaborative. Basically, how do we want to measure change across the board? We have our aim statement, as Denise mentioned, but what are some other measures that we want to be looking at to start to see if there's movement in areas that we think will help impact our aim? One of the areas that we would love to hear from you all is around data standardization. We, as a group, have been thinking about ways to best measure data standardization. And we really thought this was a good question to bring back to the collaborative to vote on which measure you think would be best. So we would love to hear from you. We have a Zoom poll that will pop up in just a second, but we would love to hear from you. If you were to pick one of these three measures to measure how we're standardizing data or whether or not we're kind of standardizing data across the community, what would you pick? So the three options, the first is the percentage of the collaborative members who have signed the California Data Exchange Framework Data Sharing Agreement. The idea with this option is that by signing the DSA, organizations are at least attesting that over time, they will align to a specific set of data standards and sharing data in a specific way. So we know that, people who have signed the DXF DSA over time will start aligning the way that data is shared, the way that data is documented in some ways and shared collectively. The second option is the percentage of collaborative members connected to the 2-in-1 CIE for San Diego, as well as San Diego Health Connect. So percentage of members of the collaborative who are connected to the local technology infrastructure, really focusing in on the CIE and the HIE in San Diego. And then the third option is a similar measure, but pulling it away from San Diego specific infrastructure and really being around connecting to any HIE or CIE. So not kind of grounding it in the local infrastructure, pulling it back a step to any infrastructure. So we would love to hear from you again, which of these three you think would be the best to measure in terms of data standardization. The way we would be collecting this data is through a poll that we'll be doing every couple of months in collaborative meetings or after collaborative meetings. So really trying to find an easy way to collect some of the data, not having to get a lot of data from you from different data sources or from specific organizations, but really just polling the collaborative members over time. So at that, I'll ask if there are any questions. And then also, Lauren, if you want to launch the poll. And feel free to popcorn out some questions if you have any. And if not, feel free to select which of these three you think would be the best way for us to measure data standardization. And we'll give this another minute or so.
And Joe, you have a question.
Yeah, just looking at it, it seems that, like number one, for example, would be very specific and you'd get, excellent data in terms of what that looks like and who's actually taken the formal step. 2 and 3, you probably get more folks there, but I'm just curious from your perspective, what would be, is there a preferred kind of, data metric here among the 3?
Yeah, it's a good question. Denise, do you want to take a first stab?
Certainly I can. I don't know that we have, I wouldn't say that there's a preference, right? I mean, I think just as a facilitator, I want to stay somewhat agnostic, but I think, looking at where the community can come together and leverage a local infrastructure is always, in many ways more successful when we think about future data standardization opportunities, right? And so, some of these are sort of setting a base, and I think all 3 of these options help us get to a data standardization base. But I would say looking at, the CIE and the HIE and local infrastructure, obviously, it has a much stronger familiarity and link and understanding around what community partners need. Danny, I don't know, do you have anything to add?
Yeah, I'll just add, in addition to that, the 3 options kind of get at different things. So the DXF one really does get more towards data standardization. But the caveat there is that for most, I would assume for most collaborative participants, you won't need to implement the DXF data sharing under the DXF, sorry guys, until 2026. So there's a longer runway there. Whereas the other 2 is more real time. So those are just other things to real time polls at least. So that's just something else to keep in mind.
Janet, I see you have a question as well.
Yeah, so I think, well, I'm just going to offer a little perspective because we have our integrated network, integrated health partners. We did not sign the data exchange framework agreement, as a number of IPAs in California have not. I think we're waiting for some more details and clarification about what that would look like, because we do not have any, we have a population health management system at our network level. We'll call it an IPA, although they won't like clinically integrated network. But the health centers own the data. The health centers have the EHR, and they need to make the connectivity. So I wouldn't, for me, we wouldn't, that is not a primary focus, and I have to pick from the other 2. What I don't know is, in general terms, like from the health plan's perspective, it doesn't matter. I mean, yes, obviously we want to connect locally. That probably is the best way to ensure the most, connectivity success at a local level. But I don't know what the other options are outside of that. And so I'm a little bit struggling between number 2 and number 3. We want to be successful in the measure, like we have our goals for this path, collaborative, and our aim goals, and we want it to be successful. But it can be a larger thing, perhaps. I don't know if one of the health plans wants to chime in and help me out with that. Like, well, the bullets are on the poll are different numbered, but if it's any health information exchange CIE, we're going to have more people saying that probably that are successful. So if we want a higher number, we would pick the more general one. But if our goal is to move towards something more local, then you pick, of course, the local answer. But maybe we'll have a less, when you poll, you're going to perhaps get less success rate.
Yeah, I thank you for that feedback. I mean, I think all of which are great points, and that's, yeah, Danny's put in the chat, same thing. That's really why we wanted to bring it here to get feedback. I think the other point that you're making around the data exchange framework and the DSA is a salient one as well, because not every organization kind of fits in neatly to those 2 boxes around required and encouraged signatories. And the same too, Janet, with regard to data stewardship versus data owning the data versus acting as someone who's doing some data analytics and supporting those in their network who own the data. So I think that's a really good point as well. Oh, Kimmy, that's another great call out. It looks like the numbers and the order on the slides is different than the one on the poll. So for those who haven't completed the poll, please make sure that you're reading what's on there. I can't see it in front of, oh, Kathleen, if you voted incorrectly, just shoot us a little note. What we can do too is, anybody else vote incorrectly?
Just me, apparently. I'll send you a note, Denise, as to which one I was hoping for.
You got it. We'll take care of it. We'll also share this with those who weren't able to attend and try and get some additional feedback. Perfect. Lauren, Danny, do we have a good number? I can't see the number of respondents. Let us know if we're ready to move forward.
Yeah, we're looking good.
Great. So I think the next bit of data that we want to share with you all, Danny, I don't know if you're still on, but if not, I can hop on.
Yeah, so I am. So for the next little section, another couple of minutes, we would like to collect a little bit of data around contracting status. So for full transparency, this is a question that DHCS has asked us to ask you. So they're really interested in learning a little bit more of who attending the collaborative is where are those that are attending the collaborative, where are they at in their contracting journey? Who are they contracted with for what community support and ECM services? As well as for those who are not yet contracted, where are they at? Have they started having conversations with managed care plans? Are they interested in contracting? Are they even eligible to contract? So we have a little poll or survey that we've put together. It's an external survey in Qualtrics. So Lauren will drop the link in the chat. But we just ask that you spend the next couple of minutes just filling it out. Again, we will be sending this out after the meeting today for those that were not able to join, but we wanted to just leave a little bit of space for those of you that are here today to provide some of this information. So it really is just related to contracting status. The information we would share back with DHCS is not at the organization level. So just want to be really clear about that. It's at the aggregate level, the number of participants that are contracted for what services, et cetera. So just wanted to be really clear about that level of granularity and how it would be shared. So we'll spend just a couple of minutes here. The slide will stay up, but if you want to click that link in the chat and fill out some of the questions that are there. If you're having any issues getting into Qualtrics, or if you have any questions about the survey, feel free to raise your hand, come off mute, put it in the chat. Whatever works for you works for us.
We'll give folks a few minutes to complete the survey. Any issues with the survey? Just let us know.
I would just add on which populations of focus you're serving, that people may not want to list out all of those because there are many. So you might get a lot of all or all but.
Yeah, so that's a really good question or comment, Mary. And we were trying to figure out the right way to design the survey where we're getting a level of granularity per managed care plan and not asking you to check a box for all of the different managed care plans if you have different community supports, for instance, that you're contracted with one versus another, which is why we left it free text, but really good call out, and we can do a little bit more thinking there.
We'll give folks another minute or two. I feel like we need music in the background or something.
I was just thinking that.
The Jeopardy song could work.
Right? That's what I'm hearing in my head, but I didn't want to start singing it out loud. I mean, you all didn't want me to start singing it out loud. I don't know, Lauren, if you can see if folks are kind of coming along, but I think we can probably keep moving forward and get into some of the work that we want to do today. And then we can make sure that we share this with folks who are not in attendance as well. So if those of you who are not complete, if you just leave that up on your browser, it's not going to go anywhere. But it's not super long, so we should be able to get through it. And then I think the other thing too, we can definitely add, Mary, to your point, is populations of focus. So we can add that when we send it out to the larger group of registrants as well. Okay, next slide I think is going to get us into our activity for the day. Wonderful, thank you. So today's activity is a continuation of last month's work. So if you can click on that link, which will get you to the Google Sheet. We're going to go into the breakout rooms that we were in last month. If you weren't in attendance last month, you'll get the same screen as everybody else with those 5 breakout rooms for our categories. And if you remember what breakout you were in before, please join that group. If not, you're free to select whichever breakout room you're interested in participating. So again, like I mentioned earlier, the whole idea is to sort of recap on where we were and what we've been able to achieve in May and in the emails that occurred after the May meeting. So thank you all that contributed and shared conversation and feedback throughout May and into June. We've taken the content from those group emails, and we've added it to this Google Sheet. So that should be updated to reflect the continued conversation through May. And then if you want to, Lauren, go one more slide over, I'll give you an idea of kind of where we are at. We'll do a quick intro when you get back into your groups. We'll have an Intrepid staff member in each of the groups for support. And then we'll do a recap and review of what you did last month. And then continue the conversation about what we know, what we need to find out, from whom, and what action do we want to take as a group. And then the other aspect of that is data measurements. So for those groups that didn't get that far, what might there be available to us to measure or test our change? So if we've kind of thought through a pilot and we need 3 to 5 participants to volunteer, what might we want them to measure along the way? So thinking about that as well. And then last but not least, for anybody that's interested in really taking a lead role in any of these categories, please feel free to sign yourself up. If not, we're going to continue to work in support of the group as well. So we'll talk a little bit about that. And then if we need to, from an administrative standpoint, take on that, that's absolutely something that we can do. Any questions before we get into those breakout rooms?
Denise, I missed last month. This is Heather from the County of San Diego. What's involved in the lead role?
So it's going to depend on the act. That's a great question. And it's really going to depend on the activities of your group. So what I would say is that in some cases, if your group has decided to pilot something, you may be working with that group to help them complete those pilot activities. If the group is looking for some data collection and they've identified that they need to find information out from different places, you may be helping to sort of facilitate gathering that information. If it's information that you have access to within your own organization, you may say, hey, I'm going to sign up and take this back as an action item and come back to the group with a report. Does that make sense?
Yes, thank you.
Yeah, absolutely. Any other questions?
This is Janet, Health Center Partners. And I know the data ask has been out in different forums for a while. Is there any updates on that before we get into our breakout session as far as identifying the specific types of data that we, there's been different outreaches and conversations about this, is there some update on what we're looking to collect on the data and some anticipated timeline when we might receive some of it or how we might approach getting the information at a local level?
Yeah, Denise, I can take a stab. So yes, there's been some movement. We've been working and talking with the managed care plans about getting some of the data that they are sending to the state. And so we're looking at least at the ECM community support enrollment data. Janet, I will be in your breakout room and I can share a little bit more. I think that there's some additional stratification that the group is looking at getting, and we'll need to kind of think strategically about what that might look like and how to do that. So short answer is yes, conversations are moving forward. We're hoping to get some of that base enrollment data this summer, and we can talk more specifics in the breakout room.
Thank you.
All right, okay, so the next screen that should pop up are the 5 different breakout rooms for you to self-select.
Denise, I'm gonna troubleshoot here for a minute. So give me like 60 seconds to get situated.
No problem. Let us know, Lauren, when you're ready. In the meantime, what we can do is just, I'll pull up that Google Sheet and we can do a quick recap of the groups and some of the conversations that are being had. So just a quick recap on the breakout rooms. They are broken into 5 categories. The first category is document standardization. The second category is data standardization and sharing. The third category is equitable engagement and service. Category 4 is community collaboration and communication. And category 5 is client enrollment. And then for each of these groups last month, you reviewed all of the different potential action items. And were asked to grade your top 3 priorities, either by importance or lift, likelihood of something being able to move forward. And then share within your group and document that on the Google Sheet. And so each of the groups got to their top 3 priorities with a little additional information on each of those. And I'm seeing that, Lauren, you were successful in the breakout rooms. For those folks, if you're looking at your room versus participant, you'll see all of our participants listed up at the very top. You can toggle to the rooms. And if you bring up that triangle, it looks like there's 46 of us that are not assigned. And then you should see each of the tabs along with the room name. Do you guys see that in your pop-up?
I'm not seeing a pop-up.
Not either.
Okay.
Are
Let's
you-
see.
You have to, if you click on the bottom, if you click on breakout rooms and it's, I guess, the third from the right, just click on breakout rooms and then it should pop up for everybody.
Yeah, it looks like people are trickling in. You'll have to assign yourself and hover over to the right and click join the blue button once you have the breakout room opportunity or the breakout room window open. Looks like people are trickling in, but if anybody needs help, just stay here and we can help you.
I think Glenn had to step away. But I want to say he's in the green room, so if he's able to come back over, I think that's the room that he was in last time.
Are you guys able to tell me which room I was in?
Let
Yep.
me take a peek.
Thank you.
And I did just get back. This is Glenn.
Wonderful. Welcome back, Glenn. I
Thank
love
you.
your shirt today, by the way.
Thank you. Figured I'd go with something understated.
I love it.
Claudia, I don't see your name in the list from last time, so you might have been in the blue group.
Yeah,
which
you're
is
in the blue.
Okay, thanks. Bye.
Bye. Anybody else need help knowing where to go or wanting to go?
I don't know how to get into the room. There we go.
Glenn,
Glenn,
we
it looks
might
like
be
you
able
were
to
in the
help you.
green. Okay, I can also assign people if they're having trouble.
All right, ladies, I'll hop over to my room and then let me know if you need anything.
Okay, sounds good. Same here. I'm going to assign Andrea to the yellow group. That's where they were last time. And Stephanie, I will put, whoa, the green tab is big. Stephanie, I'm going to put in the yellow one. Okay, Shelby, I assigned all those people. They might have stepped away for a minute, so they'll have an assignment pop on from their side, but otherwise, let me know if anything comes up.
Sure. Do we know who this County of San Diego?
I'm not sure. It might have been like a shared computer. I assigned them to the yellow room. But just hang out and see if they need any help.
Sure.
Okay, see you soon.
If that's helpful. Let me see if I can share. Oh,
It's like Lauren just joined too.
Hi, everyone. I'm here just to help answer questions or guide you if you need, but I'm kind of in the background. I'm not spying on you, just here if you really get stuck or need some support.
We're stuck and we need some support.
yes.
What's that?
A lot of us weren't there last month. And then I was going to try and share my screen, Lauren, and it's disabled. Are we supposed to be able to share the Excel with everyone?
Let me try to give you permission. Okay, there you go. You should be able to share now. Thank you, Heather. So we can take the first few minutes just to kind of read and reacquaint yourselves. It looks like last time this group met, it was Julie, Glenn, Pascal, Lindsay, and Roxanne. So it definitely might have been some time since we've been thinking about this type of stuff, and it looks like we have a much bigger group here today. So this tab, as you can see, is the community collaboration and communication kind of focus area. And then if you scroll down a little bit, there were 3, maybe 2. So column C, there's a number 1 or 2, and these were voted on as priority focus areas for community collaboration and communication. So these are some of the ideas that were thrown out, I think maybe in April, and then voted on, I think, in May. And if you go back to the top priority identified for this area was the green square. Host an ECM and community support forum for San Diego County to help facilitate a more collaborative and strategic approach to the allocation of ECM and community supports funding, helping everyone to identify both the community supports needs as well as gaps, and a community supports work group to the San Diego County Path Collaborative. And there's some notes to the right, and the notes share some ideas around how to start getting towards action items and putting that idea into action. And it looks like last time people discussed whether it makes sense for 2-on-1 CIE or SD AIM, and kind of just some logistics for getting that work group up and running. So today we can just start there, talk a little bit more about that. What needs to be done? Does it still make sense? Is it still the top priority? And if it is, how do you all kind of get there and put it into action? So this is fully in your court. Happy to help clarify or do my best, but it's really all up to you. We don't want to impose anything on you all and want the community to kind of come together and figure out what makes most sense and what is feasible for this point in the year as well.
I'm looking at Heather, but hasn't a lot of this, or at least some of this, been done? I know the county did work groups throughout the county. They looked for input. What other forums are they thinking? Unfortunately, we weren't there last time. So, because I know Heather and her team did quite a few things throughout the county. So I'm trying to figure out what else, what more of those are different, or
Was there anybody from this group that was here last time?
Roxanne was traveling.
I was here last time. I'm reading through the notes to kind of refresh my mind. I think they gave us a list of options, and we kind of, from those options, we kind of rank it of what's most needed, what's most important to kind of get that collaboration and engagement around CS and ECM. Do people know who the program, do people know about the program? How do we get people into the program? What's the best way to kind of get that advertisement piece out there in the community? And I think that's why we ranked to kind of host the ECM CS Community Support Forum in San Diego County. I'm trying to remember the rest.
Was it for providers, or is it general awareness?
I think it's general awareness and how do we identify those key players in that community in the San Diego County, whether it's churches, whether it's community centers, recs, CBOs. I think it's just as a overall gathering of key players in the community to kind of get more word out about the ECM and CS benefit.
So Kim, to your, and while I'm sharing, I don't have the ability to see back at the screen. So hopefully no one's got their hand up. Kim, to your point earlier, we are looking as far as the county to run some additional community listening sessions and start to go out to each district as a part 2. And that piece we don't yet have a date for, but that might help with addressing some of this. It was meant to be more community focused, though, in more consumer driven to talk about, because we got so many questions the first go round around, some around Medi-Cal enrollment, some around redetermination. So it was initially a bit broad, but that could be a way that it could connect.
So rather than a listening session, do you think might be better to have an educational session? Or when you say listening session, that's more like the community talking to you, right? It's not like it's maybe wanting to get the word out about the benefit.
Yeah, so I don't know if this would be more of like some type of panel or Q&A.
Well, what it reminds me of is when I think it was Whole Person Wellness went live. We used the meeting hall on Overland and had the community come in order to learn more about it. And so is that a way to get organized and bring the community together? Because we probably had a couple of hundred people. I don't know if we'd attract the same number of participants on this, but would that be a way to begin the conversation at that level, as if we had a session, a half-day session together under one roof? And the other thought that goes through my mind is that since this group is the collaboration, community collaboration and communication, and there was a comment in the notes there about 211 versus SDAIM, is it possible that 211 and SDAIM can work together, where SDAIM can bring together a convening of the important stakeholders, of the vital stakeholders, and then 211 can maybe pick up, and I don't know that we have 211 here in the room. I don't recognize any of these names being 211, but then we can have 211, maybe they can do a banner ad or something on the front of their website that talks about community support, so that we can spread the word, not just to our provider partners and CBOs, but also to the consumers.
I think that's what we were trying to capture last time, that not only do those stakeholders need to be at the table, but the people themselves, so the consumers themselves, and how can we provide some type of PSA where the consumers are more informed, because they're the ones that need to be enrolled in the program. They're the ones that the program benefit the most. So if they're not aware about these ECMs and CS programs, then really stakeholders, it's just a conversation with stakeholders and doesn't really
Well, I'm going to push back just a little on that because we rely on our provider partners to refer and enroll the consumers. So a consumer certainly can self-enroll, but I think we see greater numbers when we have a high level of participation from our partners. So I think it's bifurcated. You're not wrong, but I think that the provider piece of it is important as well.
Thank you, Kathleen.
I was thinking to your point, right, like Roxanne, what you said about more community centers or whatnot. So I think doing sort of this Q&A session, but making sure who are the players we invite is what we need to look at. Because I do definitely agree, you know, coming from the managed care side, like what Kathleen said, it's really more providers that are out there that are doing the referring versus members. Members can always call us, but I think there's such a array of possible resources out there that they're overloaded and they really don't know where to call or what to do. So I think it's just making sure when we have these, then who do we invite, and making sure it's not just, you know, the CBOs, but maybe going more to that granular, you know, the level where people are meeting, congregating, and getting those providers in to hear what these services are.
Kathleen, can you share a bit about the history as well on that whole person wellness half-day session and how that was structured?
Well, we used to have the kickoff and subsequent meetings, so it wasn't just a single session, but we would meet probably quarterly. Do you remember, Kim? Was it quarterly? And we would get together and there was an agenda prepared. It was a collaborative agenda between the county and Healthy San Diego managed care plans. And we would provide updates. We would provide motivational success stories. We would talk about some gaps. If there's anything new from DHCS, then we would bring that to the discussion table as well. But I'm thinking even for the kickoff, it was largely educational so that we knew what whole person care was and what it was going to look like in San Diego County. And what we're a year and a half into CalAIM, but it's never too late, you know, to like identify what that is. And I think rather than doing the typical CalAIM 101, it might be more beneficial to bring it to San Diego County and say, like, what does it look like today? And what successes have we seen that have come easily? And what challenges are we still battling? What's preventing enrollment at higher numbers? What are our members? Well, if they don't know what they don't know. So can we identify what our members are not aware of? And not just our members, but the provider partners as well. And we feel as health plans, like we've put it out there, we've educated, we've worked with our partners, we have contracts, we've funded our partners. But that doesn't mean that that's the only perspective. So what other perspectives are there?
And keep me honest, Lily, what I think Whole Person Wellness, we had the big kickoff, which was very successful. A lot of folks came, and then there was 2 meetings monthly, actually, not quarterly or monthly.
Okay.
There was a management meeting, and then there's the clinical meeting that Lily and Dr. Krelstein ran. And
Yes,
so,
that was a clinical, yeah, and that was with the providers directly. So we had that as well. But I think to Kathleen's point, but then we did do the big where we brought the community.
right.
I don't know if that was quarterly or every 6 months, but it was the big one was, yeah, it was either quarterly or every 6 months just to give updates and really see where everything was at. And I remembered, I think at the end, we even did it where people did have questions. They could we handed out, I think, note cards, and then they could put their question on there. So we did that at the end, a Q&A session.
You're right.
Mm-hmm. Yeah. We kind of carried that over when it morphed into having health homes. But then, but then pandemic kind of hit, right? So that changed everything. And then that's why then we were doing more like this, where we had this monthly, and then it shifted and path, DHCS took it away to kind of make it more uniform for the whole state to have these run in different regions. So yeah, it's like changed and morphed quite a bit. So maybe this is something to look at of bringing it back more to that community-based level.
Well, if that's our goal, I mean, that's one way to accomplish the goal. When I read what the goal is.
I agree.
So that's one idea, is to have those quarterly, and you'll just bear with me as I'm taking notes, and I've got all of our questions in here too. I think this will need to be fleshed out a bit more.
And I'll offer, Heather, that I think it might have been prior to your tenure, but Dr. Tudor was involved in the whole person care meeting, or I think it's San Diego, we called it whole person wellness. I think she was involved in those collaborative meetings, so she might have some historical recollection of that as well.
Okay.
Yeah.
So that's one. So the focus there was on the CBOs, right, and managed care plans in the county. Correct. And then and then Roxanne, I was hearing you mention as well, it sounds like you were looking for a second part at some type of connection with the broader community. Is that or the consumers? Could you talk a little bit more?
Yeah, I mean, the whole point of this program is member facing in some aspect, is to make sure the members are informed. We're identifying what those populations are, what the needs look like for them, and how to connect them with that service. So in some aspect, I think the conversation needs to be consumer focused in some ways, and just making sure they're well equipped of those information and who to access. I mean, I know we have this no wrong door approach perspective, but again, we do need those lead care managers and the CBOs to make those referrals be more, confirmed or complete for that member. But I think having them being empowered with the information and the education that these programs are here for them is a good piece of it.
And are you proposing that, Roxanne, at the like large community level versus the CBO level?
Well, maybe if we can connect with those key informants for those communities, like maybe churches, I don't know, maybe like rec centers, maybe we can call them into the meeting and they can be some type of voice for those, different populations. I don't know.
Yeah.
On those lines. Yeah. So maybe if it's not the member themselves attending these meetings, but those direct contact that those members have in different communities, like the churches, the rec centers.
Okay. Because I'm struggling to see our members coming to this.
Yeah. I agree.
You're right. Churches, I think, especially in some of our communities, might be the cultural center for that community. And so that might be something that would be worth pursuing as well. Instead of, I mean, we know who we know, right? But if we go beyond the walls of what we know, then that might engage groups that are more at the ground level.
Right.
I think about that. I see her with Mom's Meals, but I think about that with the food banks. I mean, that's a touch point.
Yeah.
When people regularly come and pick up a box of food, then I think that's a touch point. So yeah.
It's a start. Yeah.
This is great. I think you all are definitely on the right track. I love the idea of thinking about kind of what worked well in the past and then now how to replicate it based on what's needed for the community. Just to kind of keep everyone on track and moving forward. I see, Heather, you put some next steps in there, which is amazing. You volunteered yourself. Thank you so much. Are there any other next steps that those that have been vocal so far could sign themselves up for, or other people want to kind of raise their hand here? This definitely sounds like it's something that can be really impactful, but will be a group effort. So wondering if there's any other next steps that make sense or you could volunteer for.
I see Joe put a comment in the chat about would also like to discuss the community supports work group. Which yes, that might be something that can also be a breakout of this. I don't want to take the group back a step, and I wasn't here last month, but the center part of this goal, help everyone to identify both the community support needs as well as the gaps. I don't know if that is counterproductive to the overall goal, in that we're constantly doing that as health plans. I don't want this forum, or I'm not picturing this forum being that kind of, I want to flip it to positive. I'm struggling with my words here, but I want to flip it to positive. So can we look for opportunities? Can we look for ways to improve processes rather than looking for, we know where our gaps are. We report that to the state every month. But I want to flip it to the positive. Like, what do we do with those? Not just identifying where the gaps are, and where we're not quite as successful as we hope to be, but can we flip that somehow so it's more positive?
This may not be capturing it, Kathleen.
No, but I think you know what I'm trying to say. But like I said, I'm just struggling with my words because we talk about this time and again, but we still just talk about it. So like and we're working hard to close those gaps. So what's our steps in those areas and how can we make it more of a positive conversation rather than beating up everyone who's working so hard to close those gaps? That's just my vision on it, which might be singular to me.
In the previous work groups, or breakout sessions, one of the things that was addressed on that, and I guess it depends on how you define the needs and the gaps and really what you're looking at, but the members had shared the interest in knowing, okay, in San Diego County, what's the allocation of the funding toward the community supports, and then specifically there was a call out, well, what's the allocation toward the food is medicine community supports, and then also we've been meeting with federal, state, and local partners, and they're going, well, how's California doing in terms of the other states in terms of allocation of community supports? And I don't know the answer to that, and I was curious in that, and then also how's San Diego County doing in terms of what percentage of allocation of the total funding, of the 1.85 billion is going toward community supports in San Diego, and how does that break out across housing and food as medicine support or transportation supports? And we've asked those questions and really are still looking for information on that in terms of, okay, well, how are we doing? And my focus is specific to food security and food as medicine. We're running a food as medicine program funded through the San Diego County Board of Supervisors. And we're looking to advocate for more funding, obviously, from our perspective, for the food as medicine, but we really don't know where we're at in terms of, okay, well, is a significant amount of funding going toward that? And what we're hearing is that there's questions about the total number of referrals and what is impacting the total number of referrals for food as medicine support. So those are some of the questions. And so I think that it depends on how you're looking at this data in terms of the need, the gaps, and really what's being addressed.
That helps me to understand more of what was written there. Go ahead, Kim.
But I think we need to understand your question on allocation, because community supports is not funded. The plans pay for that. It's not funded through DHCS. It's quote unquote in lieu of services. And so in theory, so you pay for a recuperative bed because the person's not in the hospital, which means that the plan is quote unquote saving money. So there's not money allocated for community support. So I make sure folks understand that. Mm-hmm. The incentive dollars, et cetera, have been mostly focused on enhanced care management, but it's not as if we had got $1.3 billion for community supports. That's not how it works. So let's make sure folks understand that that's not, those are not funded. Those are paid for by the plan in theory to save money on other ways. So if someone is released from the hospital and we want Mama's Kitchen or Mom's Meals to come and provide meals so they're able to rest, recuperate, take their, take their medication and get better, that hopefully they won't bounce back in the hospital. That's so just so folks understand, community supports is not necessarily funded. It's paid for by the health plans, but there's no money allocated to community supports.
Right. I think there needs to be some more clarification around that, because, our understanding is that there are medically reimbursable costs in the form of community supports for food as medicine, whether it be produce prescription or medically tailored meals, and that funding, there is funding for that is reimbursable for the health plans. And so what we're looking to do is determine, okay, well, what portion of that funding is going toward food as medicine, again, housing and transportation. And we've been talking to a lot of folks, and there seems to be an interest in knowing more about that in terms of how those medically reimbursable costs are being allocated across those community supports.
We don't go to the state and say we paid $1,000 to this provider, so pay us. So they might be included going down the road. I don't want to get into details about it, just make sure, but I'm not sure the funding you guys are referencing. I'm not, as from working with the health plan, that's not my understanding, but.
We might be speaking two different languages. It
Could
might be more helpful if the way we might frame it is utilization. Because to Kim's point, it's not like funded. But again, we might be speaking two different languages on that.
Yeah.
Yeah.
Maybe funded isn't the correct word, but there's resources there for community supports. And so
not from a plan perspective, not for us to be reimbursed, but that's okay. I think we're kind of losing sight here of what we're trying to accomplish.
Joe, I think, and generally, are you just looking at, generally, you just want to know what the utilization or what the uptick is, so to speak, or connection for specific community supports?
Yeah,
for,
exactly.
For the Medi-Cal population in
Okay,
general?
that makes more sense. Yeah.
Okay.
Right. And we've been told that the San Diego County Board of Supervisors is interested in that the county itself is interested in that. So we're really looking to get a better handle on that.
Okay, more of the larger data programmatic piece, right? About from those 14 community supports, perhaps utilization in those, even though the community supports, the only tricky part that I think I was hearing from Kim and Kathleen is that it's they're approved, right? And you can correct me. It's on an individual basis, approved by the plan, and it functions a bit different than the ECM benefit.
Right. It's not a funded. It's quote unquote service. It's not a benefit. And it's not funded accordingly.
All right, so I've added on here percentage of 14 community supports, then programmatic referrals and utilization. I'm hoping that gets to that and captures everything.
And what do you mean by add a community supports a work group to the San Diego County Path Collaborative? So I've added another work group, sounds like. Is that what we're agreeing to?
Joe, could you share from the last conversation what the focus would be and how this, share a bit more?
Sure. So from previous conversations with the breakout sessions, there was an interest in from various partners in taking a look at community supports. And so right now, I believe there's for example, there's a housing community support work group. And so what we had suggested, and I wasn't aware that there was like a broader quote unquote community support work group. But one of the things that we had asked for and are looking to move forward on is a food as medicine community support work group. So to really understand like what's the opportunity, what's the need across San Diego County in terms of food as medicine community supports. So But then I see here that there's a broader interest in, putting together a community support work group. So we had suggested, well, it'd be great if there's a work group that's identifying the opportunities around housing, we would love to also identify those opportunities around food as medicine. So that's where that came from. And we've talked to various partners across San Diego County, including the Board of Supervisors and others about that. And they say, well, we would be interested in knowing more about that and participating in that work group if that was a work group that could be, could be launched.
Okay, I'm just gonna put it out there that there's 14 community supports and we cannot have 14 different work group meetings. I mean, that would, I think I might lose my mind if I had 14 different community supports work groups.
I just wanted to point out on this spreadsheet, Glenn, I think the emails that were exchanged offline, in there, he actually says that there is a ECM and community support providers work group already in place. I'm not sure when that happens, but I think that was also even a carryover from, whole person and health home days. And I think a lot of these providers kind of stayed and have some type of work groups. If we could get more information from him on when that's happening, instead of creating, right, something more.
So yeah, I was gonna say some of these are external to Healthy San Diego. So Christy with the San Diego Wellness Collaborative, they do have existing ECMCS providers that come together. And there's some spin-offs from that wellness collaborative that are focused specifically around unique components such as I think Glenn at PATH is leading one on respite care and working with the hospitals. So that might be worth kind of pulling in as well.
I will offer that in a separate work group meeting that I'm in with 211 and the Wellness Collaborative, that the provider work group is not really, not in a mean way, but it's not open to managed care plans. So it is their work group. So I don't know that, like, I think that what we were talking about is something that includes multiple stakeholder work streams, but that existing one is not open to the health plans. That's their opportunity to talk things through. Yeah. And again, I don't mean that in like, how dare they? Not at all. If they need a platform for that conversation, then more power to them. Yeah. But it would be beneficial to Lily's point to get more information from Glenn. Yeah.
So can we come back to this and revisit this one? We'll revisit the work group one, if that sounds good.
Mm-hmm.
So there was also a priority 2 for leveraging and promoting the SDM website, and then a priority 3 for develop and add ECM eligibility screener to SDM website, a diagnostic tool, consider varying modes of communication, example of printable checklist, presenting at libraries, fire stations, and other community spaces, and having community computers and technology available to complete the screeners.
And these are wonderful ideas, but I would encourage to focus on the priority at the top, or if there are parts of 2 or 3 that really should be woven into number 1, we can do that. But let's focus on this one for today and try to fill in columns D and E for next steps and sign me up. If there's anybody else that would want to be involved, I think this should be a group effort for this type of event or in-person kind of community outreach. Seems like we would need more than Heather to help with that. So let's focus on number 1. And in the next few months, if number 1 is up and running and situated, then we can move on to numbers 2 and 3.
I think we may have been thinking that this PATH CPI collaborative was going to be that forum also.
Yeah, and I think it can be part of it. And registrants or people are welcome to join the collaborative at any time. So if there are other organizations or entities that you all think should be joining these meetings, I would say absolutely get the word out, help invite them. We've done kind of what we think we can via email outreach and just utilizing our connections in the region. But I think that can only go so far. Obviously, we're not in person, we're not down on the ground in the communities as much as you all are. So I do think the idea of an in-person event and being able to kind of check off some of the boxes of ECM and community supports enrollment and engagement, as well as spreading the word for the collaborative would be amazing. So just to your point, we're happy to have people join at any time. This is an open forum. People should join if you think it's applicable for them. But at the same time, I think doing everything virtually and via email can only go so far, and via Zoom. And we're looking at being able to do an in-person event with you all. But it's different than your connections that you already have in the community.
And I think we've invited, similarly, you know, there's various network of colleagues that we know of. We've invited them to the past CPI as well.
Okay, great.
Because I think we started also, Kim, you might want to help me on this one. We also started with the original invitation that existed, which included, you know, 100 or so community stakeholders, right? Because we hijacked.
Right.
Yeah.
Right.
Yeah.
Yeah, the listserv and the amount of signups we have, I think, are around 100, 150, but we only get a subset participating in these meetings. So whenever we send out broader communications, we do use that bigger list of people that have signed up, but you know, nothing's ever perfect. We only get a certain amount of people who are able to attend each time.
Yeah. It's understandable.
Yeah. So I heard you all at the beginning talking about maybe needing to involve 211 San Diego CalAIM in the idea for priority number 1. Is that still something that we should help connect the dots there, or what else is needed for being able to host a similar event to the wellness event that you all were mentioning at the beginning?
Well, Heather, I'm not trying to add to your to-do list. And I'm fascinated by your typing and stuff.
Sorry, I'm trying to get everybody on there. So
No, I know. Yeah, it's just fascinating to watch it. Is it something that through SD-AIM, and I'm just like anointing you as the representative for SD-AIM since you're on this call, but is it something that you could also ask Dr. Tudor or get some input on a collaborative convening between that 211 and SD-AIM pull together? So is that something that you can, when you're asking Dr. Tudor about the history, can you also discuss maybe the potential for doing an in-person convening?
Sure.
Okay. And I don't know, maybe it's also an agenda topic for one of our Healthy San Diego meetings. Don't know which meeting that might be popped into, but maybe it's an agenda topic there.
Heather, maybe we can do it on our monthly meeting.
Oh, that's a better idea. Thank you, Kim.
Maybe we have our next monthly meeting.
Yeah.
Okay, and then Roxanne, I feel like you had a bunch of great ideas as well. I think everybody did, but once we get that a little further, as far as organizing, you know, some of the community perspectives and bringing folks together, and Joe as well, you know, I think we look to this group too, and definitely would want help with spreading the word. and making sure that the CBO kind of awareness component is structured appropriately.
Yeah, that sounds good, Heather. I mean, at any point, if you want to appoint me to any specific task that's community-based, because that is kind of my role right now with Mom's Meals. I'm the community supports coordinator, as like a local resource, very member facing. So really getting that educational piece out there is really important to me, because I think that's where it starts.
I like
Okay.
that, and more power to you. This is excellent. Yeah, thank you, Roxanne.
So I'm gonna add you, and then after we have the meeting with the plans as well, and I talk with Dr. T, I'll most likely reach out.
Sounds good.
Anything else for today? Heather, thank you so much for sharing your screen and helping document everything. I think this was amazing progress. Super excited to see you all stepping up and helping to organize. I think it'll be really impactful for the community. So anything else in the last 30 seconds before I close the rooms? Okay, sounds good. See you all back there in a minute.
Thank you.
Yeah. All the other rooms are being booted out in another 30 seconds. So people will start joining here, and we'll start with wrap up and some reminders.
Hey, everybody. Kelly, I know we were in the same group together. I know you got cut off. If you want to send that note over via email, I think that's an excellent point. I'll add it to our sheet. How did everybody do? Was it helpful? Was it fun? Was it awful? Thumb up, thumb down. Like, let's never do this again, folks. Feel free to share. Yeah, I think that's the other thing too, Danny. Good question. Too much time, too little time. That would be really helpful. I'm seeing some thumbs up. We'll continue to share. What we'll do is we'll work internally on behalf of each of the teams and send out an email to each of you with just sort of a snapshot. Here's what we were able to do. Here's what we weren't, and would love to do with like a next step. I have some action items from my team that I've taken on, so I'll just share those so that they're cemented in an email. I don't know that we have enough time for a group share, but I would like to be able to do that. So I don't know if you want to, one more slide over, Lauren. I think we just have some just upcoming things I want to shout out, and then maybe we can do a quick round robin. But there is a survey that DHCS sent out. Emily sent it to you all. If you haven't filled it out yet, please definitely take advantage of that. It's also attached to the agenda, but we can send a link via Slack. And that is due back to DHCS by the 30th. And then the next meeting is Friday, July 28th. And that's our next monthly meeting. Stay tuned. We'll have some other events come up in July. We're trying to solidify them now. And as they do, we'll communicate through our normal channels, Slack and email. Anybody want to share any ahas or any exciting things that you're going to be doing in your group?
No ahas. This is Janet, just making progress, and I think, once a month, this is the only place that we have to come together and work on the structure. We have other opportunities with some of the CIE provider work and within our local organizations, but to come together and be able to have the breakout time can be really productive. So that's appreciated.
Thanks for that, Janet. Too, the other thing is, let us know if there's things that you think would make the breakouts more productive, maybe, or that you really like about the way that they're structured today. So positive, negative, just any feedback there would be helpful.
Oh, it was nice to have Danny instead of me typing. And I struggled with that last time. I'm not familiar with the Google Sheet, so that was really helpful.
Point noted. There'll be an Intrepid representative in each of the groups moving forward. We try to do that as best we can, just on a staffing standpoint, but we recognize that that's a priority, and we'll continue to make it a priority on our side as well. All right. Well, it's about 5 minutes to. If you all want to take the time for a mini break, or if you have anything to share, we'll stay on. If anybody has any questions, issues, problems, thoughts. But otherwise, I hope you all enjoy the rest of your Friday and that you have a great weekend.
And the next meeting is on Friday, June 30th, the 28th is a Wednesday. Did you catch that on the slide? The previous slide is the wrong date.
Oh my goodness. Janet, I did not catch that at all. Folks, don't write that meeting down.
Oh, wait, maybe July. Oh, July is the 20th.
Yeah, no, I think you're looking at June.
I'm sorry. So we're not meeting next week.
We are not meeting next week. You should have gotten a cancellation because our coffee chat was scheduled for Monday. Okay. And I thought maybe that would be a little bit too much for you all, Friday and then again on a Monday. So I figured I'd give you a breather. But we do have a couple of other opportunities coming up in July, and we'll send those out through announcements. We're just trying to solidify some of the details, but our next monthly meeting will be at the end of July.
Yep, my mistake. Thank you.
No, that's okay. I've had issues with dates as of late, so I'm glad that we've got it sorted. For anybody that's still on, we'll stay on. The Intrepid folks will stay on. If you have any questions, feedback, the meeting will stay on and we'll stay over to address any of that. But for anybody else, if you're ready to hop, I hope you have a great Friday and weekend. Ava, Robert, Chris, did you have any feedback that you wanted to share?
I did not, but thank you for checking in. I was trying to see if Joe was still on the call.
No, but I did touch base with him briefly before before we started our call today, and I think he said he mentioned he sent me an email, so I owe a follow-up to that.
Okay, great. Thanks, Denise. Have a great rest of your day.
Thanks, you too.
Bye.
Robert, how about you? Any issues, questions? Dr. Dauber? We might have some folks multitasking. Lauren, Shelby, Sokim, feel free to drop. Lauren, if you drop, it ends the meeting, yeah?
I'll transfer it to you, but yeah, I'm gonna hop. Thanks, Denise.
Yep.